Good morning, everyone, and welcome to the Ministry of Health's press conference, which will provide an update on the ministry's response to COVID-19. A special good morning to our live viewing audience via online and live broadcast. At the head table, we have faces that you know well: Dr. Roshan Parasram, the Chief Medical Officer; Dr. Miriam Abdul Richards, the Principal Medical Officer Institutions; and Dr. Avery Hines, Technical Director of the Epidemiology Division. I'm Candice Alcantara, Manager Corporate Communications, for the Ministry of Health, and I will be your moderator this morning. Dr. Parasram will provide the clinical update, and then we will move into presentations from Dr. Richards and Dr. Hines. After that will be the question and answer segment, and the panel will field questions from the media representatives that are here in-house today. We will move straight to the clinical update, and I invite Dr. Parasram to the podium.
Thank you, Ms. Alcantara. Good morning. I'm Dr. Miriam Richards, Principal Medical Officer Institutions, Dr. Avery Hines, Technical Director Epidemiology Division, members of the media, members of the viewing and listening public. So the clinical update for today, the 12th of August 2020, is as follows. The number of samples submitted to the Caribbean Public Health Agency, as well as the University of the West Indies site for testing, now stands at 11,710. Number of unique patient tests completed thus far, 10,119. Number of repeated tests, 1,591. The number of samples which have tested positive at the public health and private sector now stand at 308. Community tests, 8,267. Total number of active cases, 161. Number of deaths remain at 8. Number of persons discharged are now at 139. In terms of the positives, over the last morning, we have 8 positives reported below. One of those persons is from Tobago, the other 7 from Trinidad. 5 of those cases are pending investigation, and the other 3 are contacts of recently positive cases. By way of the hospitalized patients, we have 126 persons in hospital at this time. 15 patients are en route. Those are 7 individuals that we would have had from last night, including the 8 persons from this morning. I think the 1 person from Tobago is already in hospital. By way of our quarantine facilities, we have 194 individuals at various facilities. The Home of Football, we have 15 individuals. At the Chancellor Hotel, there are 26 persons. At the Paria Suites, there are 92. Cascadia, there are 4 individuals. And the Regent Star, there are 57. In terms of our suspected cases who need hospitalization, so there are 2 broad categories. Suspects who have very mild illnesses, we take swabs from those individuals, ask them to home quarantine pending their results, which will be informed of by the CMOH. Those individuals that are in hospital are moderately to severely ill, and there are 8 persons at the Augustus Long facility and 9 persons at the Arima facility, giving us a total of 17 persons at this time. Dr. Richards will go into a little bit of the step-down facilities and what we intend to do over the next coming days and weeks. We are looking towards, in light of the recent movement of individuals and somewhat non-adherence to the public health guidelines, we expect to see an increase in the number of cases over the next few days to weeks. In light of that, we are trying to get our hospitalized patients out into step-down facilities as quickly as we can, which we have done before, anticipating the need for a greater number of hospital beds. So Dr. Richards will go into a little more detail, and then Dr. Hines will go into the epidemiological status.
Thank you very much, Dr. Parasram. We invite now Dr. Richards to the podium to give us some background information on the step-down facilities which form a part of the parallel healthcare system. Dr. Richards, the podium is yours.
Good morning, Chief Medical Officer Dr. Roshan Parasram, Technical Director of the Epidemiology Division, Dr. Avery Hines, members of the media, and members of our listening public. I will be speaking on the parallel healthcare system and the percentage occupancy at present. At present, the parallel healthcare system is the health sector's response to the COVID-19 pandemic. We are looking at the hospitals, and it's a 4-level tiered system that ensures the best level of care for each type of patients. As Dr. Parasram indicated, we have 77 patients at the Couva Hospital. We have a total of 175 beds there, so we are close to 50% occupancy. At the Cora Hospital, we have a total of 44 patients, and that adds to our occupancy of about 40%. These are COVID positive patients. At our step-down facilities right now, we have 20 patients at the Brooklyn Center. This is about 66% of the occupancy that is at that hospital. At present, we are preparing 2 step-down facilities. That is the Tacarigua Center, which we expect to have 40 patients which are COVID positive from 2 centers. That is the Cora Hospital and the Couva Hospital. We also expect to prepare another center, which is the Balandra Center, with 40 patients on average. Again, this center will be prepared on Thursday morning. So we are expecting to have 80 persons transferred from the Couva Hospital and the Cora Hospital. I would now speak about the suspect cases and percentage occupancy. The suspect cases are housed at the Augustus Long Hospital, and presently we have 8 patients out of 50 beds. So we are looking at just under 20%, about 18% occupancy. Another area that we are looking at COVID suspect patients is at the Arima General Hospital, which was recently commissioned. At present, we have 9 patients out of a total of 90 patients, which is 10%. The other category of persons are at the state-supervised facilities. Those are the hotels. The Ministry of Health provides medical coverage, although the accommodation logistics are handled by the hotels themselves. At the Chancellor Hotel, we have 100% occupancy with 26 persons. At the Paria Hotel, which houses the U.S. cohort that was recently brought in on Saturday night, we have 92 persons, which is at 100% capacity. At the Cascadia Hotel, we have 4 persons, which is about just under 10%. And at the Regent Star Hotel, we have 57 persons, which is about 90% occupancy. As can be seen from the figures that have been discussed by the CMO and myself, we have 194 persons. I neglected to mention the quarantine facilities, which house persons who are who undergo state quarantine. At the David facility, we have 0 patients at present, and this facility is activated for the returning nationals from the United Kingdom. At the Home of Football, we have 15 patients out of a percentage occupancy of around 60 persons, and that itself is 25%. As can be seen from the 4 levels of care, we have the greatest percentage of patients at the hospitals, and that is COVID positive patients, with persons who are at 151. As of this morning, we have 15 patients en route, but as of tomorrow evening, we would have 80 patients in step-down facilities, which require a lower level of care than the hospitals, which of course translates into a lower cost of care per capita. The step-down facilities are the centers that prepare persons closer to home, and persons have a greater degree of independence than at the hospitals. That is at the Cora and Couva facilities. These facilities are being made ready by the CMOH of St. Andrew, St. David, and will be run by the primary care and public health specialist physicians. At present, we have 194 persons at the quarantine facilities. We expect to have 8 returning nationals and 14 foreigners today. Of course, the logistics of the transfer from the Piarco Airport are controlled by the Trinidad and Tobago Defense Force. I would like to commend the Trinidad and Tobago Defense Force, which is an arm of the Ministry of National Security. The Honorable Minister of National Security, up until 6 p.m. on Monday, that is Stuart Young, the Permanent Secretary, P.S. Gary Joseph, for their efficiency in processing exemptions and the logistics of transfers, which are handled by the Trinidad and Tobago Defense Force. As can be seen from our figures, our parallel healthcare system is currently not stressed as opposed to and currently operational in terms of the parallel healthcare system. This, I remind you, is the health sector's response to the international pandemic of COVID-19. I will now hand over to Dr. Avery Hines, Technical Director of the Epidemiology Division, and Candice, who will introduce him. Thank you very much.
Thank you very much, Dr. Richards. And as you see, there's a high level of logistical planning that is involved. But at the Ministry of Health, we are taking a proactive approach to the work that we do. I welcome now to the podium Dr. Hines, who will give us an epidemiological update.
Good morning, Dr. Parasram, Dr. Richards, members of the media, members of the viewing and listening public. I am about to do a quick recap of the, as we call it, the sort of second phase of this COVID-19 pandemic within the Trinidad and Tobago population, looking at the pattern of illness and the pattern of epidemiologic linkage that we have discovered since discovering the first of other locally based cases. I'd like to throw up one diagram, which just shows the number of new cases that we had diagnosed and confirmed per day between the first local case on the 20th of July and the 10th of August, 2 days ago. We are updating the graphics for the next 2 days as we speak. But the first thing I wanted to point out with this is that what you can see is a slow but steady increase in the number of daily cases. The highest we have seen when we actually disaggregate the date on which the test was completed, as opposed to the dates on which some of the aggregate reports were generated. The dates on which the tests were completed show that at most so far we've had 22 cases as a maximum in a given day. We are looking at the epidemiological linkage between cases. We have found that there have been several clusters of illness identified in members of families, in members of similar workplaces, in members of group activities, including outdoor gatherings. And what we've seen is that out of the cases we've identified here, we have about 64% of those that we can link to one another in one way or another. 64% of those belong to existing clusters. One of the things that I think we need to clarify or to get a better understanding out to the public on is what we mean by pending epidemiologic investigation. When we begin an epidemiologic investigation, we don't walk up to someone, scan the QR code on their forehead and get all their epi info. It's an iterative process where we ask about activities, we ask about interactions, we ask about locations. And in so doing, we get some idea of who they might have exposed as well as where they may have been exposed. Sometimes people don't remember where they went, don't remember who they've been in contact with. Sometimes they withhold information and they give the information later. So it's an ongoing process, and you will find that the figures we have on linkages and clusters will change, will evolve as more information becomes available to us. So the ones pending investigation, as those new cases are identified, the investigation begins. When we have asked as many questions as we can, gotten as many answers as are possible, we conclude an investigation for a given individual. And we determine whether we can link them to another cluster or whether their origin is unknown. At this point in time, we have identified that, as we've said before, certain settings are highest risk for transmission. We've said that the home setting, sometimes the workplace, definitely those close gatherings in bars and other gathering places, religious organizations, religious gatherings, formal or informal, those have been the highest risk scenarios. And as we've seen, there's been a fair amount of gathering and movement over the past few days, which, as the CMO alluded to, we expect will cause an increase in the number of cases. What we would like to emphasize is that the public health guidelines that we have given repeatedly are the ones that still hold. if persons are ill, if persons have respiratory symptoms, if persons have even the mildest of respiratory symptoms or viral symptoms, we do encourage them to do one of two things: either remain at home in isolation or go directly to a health facility to seek medical care, declaring their symptoms so that they can be put through the appropriate pathway in the facility. We've seen that persons have not recognized some of their usual sniffles and sore throats, etc., as actual symptoms of a COVID-19 infection, because the infections can be quite mild. They can mimic the sinusitis and the asthma and the other things that people have as background illness. So anybody experiencing flares of those symptoms at this point is encouraged not to dismiss it as, I got wet in the rain, or it's because of the dust, or this is my usual sinus story acting up, but to be a little more aware that any symptom right now should be treated with a different level of care and suspicion. We would want to encourage anyone who is ill not to go to work, not to go to school, not to go to the gatherings that they would normally have gone to isolate themselves at home from their families as well, following the precautions on hand washing, staying in your room, and not sharing utensils and spaces even within the household. If any of the symptoms are more serious and require medical care, we encourage you not to hesitate to seek that care. So more severe fatigue, tightness of the chest, shortness of breath, any of those things, definitely don't remain at home with those. Definitely go out to seek care. We encourage as many people as possible, and we have seen the increase that suggests that the encouragement is being heeded. As many people as possible who have respiratory symptoms, they encourage to go to the designated testing facilities in each of the counties to have the swabs done, so that we have a better understanding of what is in circulation in the population at this point in time. I think I will tie it up there and turn you back over to Ms. Alcantara, who will take us through the Q&A section.
Check.
Thank you very much. We get numbers every day from the twice daily updates, and very happy that Dr. Hines was able to put those numbers into context and help us to understand what's really happening. And so we begin the question and answer segment now. As is customary, we invite the media to indicate the media house that you represent and your name before posing your question. A microphone will be provided. Do we have a first question?
Hi, morning. You all hear me? All right. Morning, everyone. Rashad Khan, Guardian Media Limited. CMO, would you be in a position to say, and I know you mentioned it at the previous press conference, that there was a change in the reporting which has given us this lag in data that we are getting. Are you in a position to say if at any point in time in the near future this lag is going to be resolved and we could be seeing more real-time data as we've been seeing before?
Right, so as you may have noted over the last few days, there has been some resolution to the issue. Sorry? Yeah? Yeah, so as you may have noted, there has been some resolution to the issue. No volume?
Okay, that's no problem. We will just let Dr. Parashram use the other mic so that everyone can hear clearly.
Sure. So hear me now?
Is that better?
We okay?
Okay. Dr.
Yeah,
Parashram,
sure.
just
No problem. So as we noted before, there has been some resolution. So when we picked up the issue, there was a delay of up to 8 or 9 days in the reporting of the results. So we have had a meeting just up to yesterday to find the solutions to the issues that were pertaining. The Principal Medical Officer of Epidemiology, Dr. Nadram, has written to the lab directly to ask for a formal report to see where the issue lies. However, we have noted certain issues that we have been able to rectify quickly. As you know, in the first phase, this was not an issue. We were reporting real time. This only happened about a week to 10 days prior. And again, the reporting is much better now. There was a little lag over the last weekend, which occurred only about 2 days or 3 days, but that occurred because we received some results from a private sector lab, and that took a little time to get to us. So that was the only delay. But over the last 4 or 5 days, there has been more or less resolution of the issue.
Thank you. Dr. Richards, I noticed you were speaking about the parallel system and calling out some figures, but I'm hearing word that somebody in the parallel system who's a suspected patient may have died recently within the past 24 to 48 hours. Could you confirm if this has happened?
We had one patient who was brought into the parallel healthcare system as a suspect case at the Augustus Long Hospital. However, we did a COVID-19 test and that was returned as negative.
Okay, so it was something else that the person would have died from. Okay.
Thank you very much, Mr. Khan. Any other questions? And I think the panelists, just ensure we have good volume level, we may need to take the mic off of the stand and hold it close so that we make sure everyone hears every word of the response. Please go ahead.
Hi, Ryan Hamilton Davis, Trinidad Newsday. I know there was a expression of concern earlier with the amount of movement recently, and a suspicion that there might be more cases. But could you quantify how intense it could be, and if you could tell me if by observation you'll notice, despite whether or not despite the movement and whatnot, if PPE was used in a high amount of, and so on.
Right. So in terms of looking at the movement that we would have seen, you saw there was some non-adherence to the guidelines, meaning that persons weren't wearing masks. There wasn't much social distancing in certain settings. There were large crowds, very large crowds beyond the 10, as we had said. We had moved just before, about a week or so ago, back to 10 as a number in public gatherings from 25. And what we expected is that there would be decreased congregation. I think the opposite resulted. There was a large amount of movement over the last 2 weeks. And again, non-adherence to the guidelines. No one can predict for sure what is going to be the outcome. If you have a crowd of 1,000 people gathering and no one has COVID-19 or COVID-19 related symptoms, obviously out of that one event, nothing will happen. However, if you have a crowded situation where you have a number of suspected individuals or positive cases roaming around in that environment, you'll get an explosion of cases about a week later. So it really depends on what sort of movement you had, the amount of mask wearing that was occurring, social gatherings. There's a lot of variables to take into consideration, but I don't think anyone can sit and predict what is going to happen. But we do expect, because of increased movement, that you will get an increase in viral illness in general, outside of COVID, and then of course maybe an increase in COVID-related cases, as we have seen going all the way back to the Spanish flu of 1918. Right after, there was a release in the public health guidelines allowing people to move. Up to 3 days or 4 days later, we would have seen a considerable spike in the number of cases of Spanish flu in those days. So, I mean, the public health guidelines are there for a reason. It's really to prevent the spread of viral illness from one person to the next, and that is the premise is based on. So if you have congregation, you expect to see a spike, more or less. So again, we can't say how much that spike is going to be, and we hope that it is minimal, but again, we have to prepare for the worst.
There's also the matter of one case of a prisoner getting COVID-19 and 2 prison officers. What is the advice that you could give to the prison service, or what advice have you given to the prison service so
the
far?
county medical officer of health for that particular jurisdiction has been in contact with the prison officers directly in terms of the medical officers there and the supervisors. I have relayed the information to National Security as well so we can get it to the commissioner. As you would have noted, there was a prison officer linked to that prison that would have been ill with COVID-19 the week prior. So we're trying to establish a link as to how that individual would have gotten COVID at the time. So that will require tracking and tracing. But what we will do in the first instance is ensure that everyone that is symptomatic in the prison is tested as quickly as we can. Persons are already in a sort of quarantine environment in that setting. We isolate as many people out of the areas, sanitize the areas that we find persons would have been infected in, and we continue to test, quarantine, and track within that setting as many people as we can to ensure that the prison population is not affected beyond a few persons.
Thank you very much, CMO. And we move now to questions from TTT.
Good morning, Karen Kuzia-Philip from TTT. I don't know if you can give us an update as to the location or the jurisdiction as to where we have seen these spikes in COVID-19 around the country. And also, Dr. Hines, you said that if you have a a flare-up in sinusitis, you should take it seriously. But how would you know when to say, okay, this is not sinusitis, this is COVID-19, I need to go get tested?
Okay, so in terms of I would have shown on Saturday a graphical image, a GIS map of the localities of different positive cases. I think more or less we are around the same sort of localities, meaning going across the east-west corridor, going down to Caroni and to Victoria area counties. So it stays within that particular jurisdiction. As you noted, there was one particular case that went to an event in Tobago. In addition to that, we got a one positive from Tobago as well yesterday. So beyond those changes in geographical pattern, I think we're more or less the same as I did showed on Saturday. All right?
Dr. Hines?
Okay, just to add to the geographic response, what you're going to find is that persons that live in the more urbanized, the more populated areas are the ones that have the greater chance of transmitting illness between groups. And what we're seeing is basically distribution along the more populated parts of the country at this point in time. There isn't a single focus. What we see is several clusters that are related to related persons moving around, but it is spread basically across the population centers. Now, going back to your second question, I'm glad you asked it because it gives me the opportunity to discourage people from trying to determine for themselves whether what they have is COVID-19 or not. It is not possible to tell, just based on your own symptomatology, whether you have COVID or if it's just a flare of your normal background symptoms. Again, the advice that we're giving is that you do one of two things if you have respiratory illness. If you have respiratory illness and you are not severely ill and you are not in a position where you believe that going to test it would be the most either convenient, logical, or workable thing for you, the first thing we want you to do is to self-isolate. Remain in your home, away from the persons in your home so that you do not provide an additional risk of infection within the household. If you're going to move around to anywhere, the only places that we would like persons with symptoms to be going to would be to a health facility to declare the symptoms, to seek treatment, and testing as appropriate. So those would be the two movements that any persons with any kinds of symptoms would be advised to make at this point in time.
Thank you very much. And just to let you know that we will continue to share tips and guidelines on how to self-isolate via our website and also via social media. And we go back to Mr. Khan.
Hi. Yeah. All right. So considering that we anticipate a spike, or that we're hoping at least that we don't see one, but we anticipate that there might be a spike coming out of this election period, has any sort of official recommendation or advice being given to the Ministry of National Security with respect to the amount of exemptions that are being given in order to maintain that balance between the healthcare systems?
Right. So basically, we would keep the Ministry of National Security abreast of the present status of our quarantine facilities as well as the hospital setting. And as the Minister of National Security, the decision is ultimately on the Ministry of National Security to make the decisions regarding the exemptions. So we advise by way of availability of quarantine facilities, and then that is taken, one of the factors that are taken into account when they make the ultimate decision.
Okay, but has any advice been given?
It is being done continuously. We share whatever information we have regarding the status of the facilities through Dr. Richards, liaises directly with PS in the Ministry of National Security on a continuous basis to ensure that that information is shared.
Thank you.
In terms of the prison,
sorry,
just an
CM.
update, Candice. The St. George West CMOH just indicated to me that all the close contacts were already tested yesterday, and those results will be forthcoming. All right.
Thank you, CMO. I think we have some more questions.
Okay, so Alicia Boucher from TV6 News. I just quickly wanted to ask Dr. Hines, do we know how many of the overall cases right now that we have where the origin of those cases are unknown? Can you give us a figure? And in terms of, you know, we're advising persons if they have a flare-up of sinusitis or any other flu-like symptoms to go and get themselves tested, to quarantine or go and get themselves tested. What about persons who may have gone to a public health facility, found that perhaps they did not take their symptoms seriously. They're uneasy about it. A lot of persons are still complaining that they don't have that the hotline isn't working as efficiently. Is there a system that those persons who feel that their case or their matter isn't being taken seriously, where they can literally go and get the requisite treatment that makes them feel comfortable?
Okay, I'm going to take the second question first, and I'm going to take the last part of the second question as the primary response. With regard to the hotlines, as you would imagine, are being inundated with calls, and the calls that are being forwarded to the hotline in some cases are calls that should not be placed on the hotline asking for laboratory results. That's not one of the functions of the hotline. So I'm hoping that the statements about the hotline not working efficiently aren't being based on the assumption that information that shouldn't come from the hotline isn't coming from the hotline. So to clarify, the hotline is for making note of concerns, is for making note of potential exposures that you think need to be brought to the attention of the public health officials. All of the information that is shared with the hotline officers is then transferred to the group of the county medical officers of health and myself and other persons who can assess and then provide a response. So when the hotline is utilized and persons do call, we would also like to encourage them to provide enough information for us to get back to them to follow up. With regard to feeling that you may not have had the satisfactory encounter with the health system, this is another thing that you can actually register at the hotline, again with the information that would allow the relevant officials to get back to you, to follow up with you, to resolve the issue where it is needed. No.
But what if you can't get on to the hotline, is the question.
Well, if you can't get onto the hotline, it's because all the lines are filled, and the only thing that we can do in terms of a recommendation is to advise to try again. The lines will at some point be open, but we're having a lot of calls. The important bit of information on not calling the hotline for things that aren't the domain of the hotline will hopefully reduce some of that burden. So we want to encourage people not to call the hotline to get their results. That's not where you're going to get results from. Not to call the hotline to ask when they're going to come out of quarantine. Again, these are questions that go back to the officers with whom the patients would have interacted, either to have the tests done or to begin quarantine. Now, going back to the first question, at this point, we get new cases, new positives on us, several per hour or several per day, or how many ever come out of the lab at a given point in time basis. As we commence the investigations and move through with them, we have a given number that we're working with. The ones that we just showed on the demographic, let's just put that graphic back up for a moment. There may be about 139 of those where we say we have completed or come to the end of our investigations and determined that about 89 of those were persons that we could find a link for, so about 64% of that grouping. We are still in the process of identifying potential links and continuing investigation on the newer cases that we would have received. So I'm not in a position to give a final figure on those just yet because they're still under investigation. But so far we have about 64% of the ones that were completed that we found had some sort of link.
Thank you very much, Dr. Hines. And I just want to remind the public that they can also call the hotline for the Southwest Regional Health Authority and for the Eastern Regional Health Authority. Those of you in Tobago, 800-HEAL is the number that you can use. And we will, of course, share this information again, as we have been, via our social media platforms and our website.
Hi, real quick, just to tag on to Ms. Boucher's question, Ryan Hamilton Davis from the Newsday again. Could you give, even if it's a ballpark figure, of how many calls come into the hotline per day, or on an average basis? That would be one question. And secondly, with regard to probably issues with immigrations, whether how do immigrants find a way to get into contact? You know, if they are somewhat sick, or if they have a suspicion that they may have the virus, and if there are like measures put in place for them.
I think Ms. Alcantara can probably share afterwards the numbers of calls that we have been getting for different days, all right? So she could share that with you all. In terms of the relationship with the immigrants, what we have been doing even before COVID, we had an established relationship with IOM, which is the International Organization for Migrants, as well as TT Solnet, who actually works with a particular sector of the migrants. So what we were trying to do is, one, disseminate information in their language to them, to let them know what the signs and symptoms are, where they can go to be treated, to be diagnosed, and all of that. So that information has been shared with IOM and Solnet and disseminated, we hope, onward transmission to the populations therein. So that is one of the main things we have been doing, making sure that they have the information, they know where to go, where to seek treatment, they know the signs and symptoms. The other part of it, as you know, there's a non-nationals treatment policy that speaks to treatment of all non-nationals, as well as it levels the playing field for public health diseases. So non-nationals are afforded the same level of care, all the way up to ICU care, if needed, and surgery for any public health related matter. So you'll be given the full level of care, whether you are national or non-national. So that affords everyone similar treatment for COVID-19 and other such communicable diseases. So we're hoping that, you know, if persons become ill, they present to our facilities, they get the treatment that they need. And of course, none will be turned away. They'll be given everything that they require.
Thank you very much, CMO. And a little more information, the ERHA hotline number is 877-3742. And the number for Southwest Regional Health Authority is 877-9742. And we will continue, as I said, to put this up on our social media platforms. Ms. Bouchier?
Thank you. I just have two quick questions. Has anyone at Five Islands, or has there been a case coming out of Five Islands? That's the first question. And the second question is that there is word that a businessman tested positive for COVID-19 and was allowed to home quarantine. I don't know whether that's a fact or rumor, but maybe you can pronounce on that.
Okay, so not that we know of for the first question. In terms of your second question, you're speaking of a particular case that was allowed to home quarantine after being positive? That's the question you're asking?
Yes, that's... Yes.
So, as you know, the national policy as it stands, once you are positive, you are transferred immediately, as soon as possible, to one of the treatment facilities, which is either CORA or CUVA. There may be certain instances where persons have a positive, and in terms of transition, as you would have seen in our reports, we say en route. Persons are en route, so they may be at their home for a few hours, sometimes overnight, until we can transport that particular individual. But we ask, of course, that you stay at home once you have a positive result, or even if you have a swab pending result, that you stay at home and self-isolate. We don't move until we know what the result is, giving you a negative result. And even beyond a negative for COVID-19, you may have some other infectious disease that can be spread. So you wait till your symptoms abate, and then you move into the population, thereby decreasing the amount of viral illness in circulation in general as well. Okay?
Thank you, and we're just about out of time. We'll go to Richard Khan, if you can keep your question brief, and then back to TTA. Please keep your question brief, and let's go to one question each, please.
Okay, all right. Thank you very much, Candice. Okay, I'm being made aware that there may possibly have been a situation right here at Mount Hope which has affected the screening at the emergency department after a manager may have tested positive for the virus and some staff were sent home on quarantine. I just want to know if you have any information on that, if you could confirm that.
We could look into it for you, but we don't have any information at this time.
Sure.
Okay, my final question. The second case in Tobago, is it related to the first case, the person that traveled from Trinidad to Tobago, or is it someone that was found in the public domain?
I think Tobago will do a release later on and maybe a press conference tomorrow, but it is an unrelated case that presented. So it's not related to the first case that went across.
Okay, thank you very much. I think we've come to the end of this morning's press conference. I just want to thank everyone for your participation, our panelists, Dr. Parashram, Dr. Richards, and Dr. Hines, the Information Division for their support, members of the media. I must say the members of the media really complied with all the requirements, and we ask everyone to do your part to protect yourself, your loved ones, and everyone. Stay away from others, especially those who are ill. Wash your hands with soap and water, or use hand sanitizer, and please wear a mask. We will all be wearing our masks as soon as we end this press conference. Thank you very much and have a good day.